Well, good morning. My name is Chris Rowena, Lead Communications Analyst at Health Workforce Development. We're excited that you have joined us today for the Small Rural Health Improvement Program, or SHIP, grant webinar. Before we begin, I'd like to discuss a few housekeeping items. First off, our webinar is hosted in Microsoft Teams. If you are not familiar with the platform, you can find the view controls and the chat feature in the menu bar at the top of your screen. Number two, the webinar will be recorded and posted on our website in approximately 7 to 10 business days. Next, the chat option will be open for asking questions during the presentation, and we will be answering them at our Q&A session, which is at the end of this webinar today. And lastly, all of the resources for today's presentation, including the slide deck, are linked in the chat box as well. All of them can be found on our website. And with that, I am thrilled to introduce Nathan Dixon, Program Manager for SHIP.
Hi, good morning, everyone. Can you hear me okay? I'm worried I'm still having a microphone issue. Perfect. Okay. Well, thank you for joining us for the SHIP webinar this morning. This webinar is intended to go over some of the basics of the program, as well as to introduce the new application process that we have moved the application over to. The application itself has not necessarily changed in any dramatic way, but we wanted to make sure that all current and new participants in the program had at least a brief introduction to the new application process. So with that, I'll jump right in. Today's presentation will cover an overview of the program. We will look at hospital eligibility. We will do a brief overview of allowable projects, important dates associated with the program and the application cycle, and the application process itself. Next slide. Some of you may be aware already, some maybe not. The Small Rural Hospital Improvement Program provides annual grants to help small rural hospitals meet value-based payment and care goals. This is done through investments in hardware, software, and training, with the overall intent of improving quality of care to underserved populations in California. SHIP is administered in California through HCAI and the California State Office of Rural Health, and the program receives funding from the Federal Office of Rural Health Policy. So this is a federally funded program run at the state level by the state. Next slide. The funding itself, the fiscal year for SHIP runs between June 1st and May 31st of each year. The funding amount is actually announced each year by HRSA after all applications are submitted. So while applying for the program, we offer an expected award amount, but the final award amount is not determined until after applications are submitted to the feds. Because of the way that works, that means that every eligible applicant will receive equal funding so long as there is funding available at the federal level. And continued yearly funding is dependent upon receiving those federal funds and the funding being available at the federal level. Next slide. So why SHIP? I mentioned briefly, but SHIP is intended to provide financial incentives to support improvement to quality of service, reduce medical errors, and improve hospital financial processes. That's the core intent of the program. Additionally, the program does offer various networking opportunities and training and educational opportunities. These are primarily offered through the federal organizations associated with SHIP. HCAI does offer, I believe it's twice a year, the Office of Rural Health offers a couple meetings that allow networking opportunities between hospitals. But for the most part, these networking opportunities and training and educational opportunities are offered through federal agencies associated with the program. Next slide. And hospital eligibility. This is pretty straightforward. To be eligible for the program, a participating hospital must be located in California, in a rural area, that is outside a metropolitan statistical area, or in a rural census tract of an MSA. You do have to be a non-federal, short-term, general acute care facility. You do need to staff 49 beds or fewer. We do offer the option to hospitals that have more beds, more than 49 beds, to apply, but you will need to provide documentation indicating you staff only 49 or fewer beds. And there is a requirement that you meet federal priorities specified in each yearly application. The application will cover any federal priorities if there are any. And then as additional notes, hospitals can be for-profit, non-for-profit, tribal, or faith-based. Any of those can be eligible, and critical access hospitals are automatically eligible for the program, independent of any other factors. Next slide. So allowable projects. SHIP grants hospitals funding for a number of, I mean, it's a pretty long list of potential projects. We don't dictate specifically how the money is spent, but money must be spent on a general category of allowable projects. Those allowable projects fall into 3 different categories listed here. We have value-based purchasing investment activities, which support improved data collection to facilitate quality reporting and improvement. We have accountable care organization or shared savings investment activities, which support the development or the basic tenets of ACOs or shared savings programs. And then we have payment bundling or prospective payment system investment activities, which are intended to improve your financial process. Next slide. And here we're breaking down some of the allowable projects. Again, these aren't necessarily exact. These aren't dictated. When you're submitting your application, we do ask you to define a project that fits within one of these categories. You select a category on the application, then you define the project that fits within that category so we can determine the eligibility of the project. I won't run down the whole list here because some of these categories have quite a few options, but you can see value-based purchasing covers quality reporting, MBQIP data collection. I never know if MBQIP is the right way to say that. Efficiency or quality improvement, provider-based clinic quality measures, and alternative payment models are all included under the value-based purchasing category. Next slide. Payment bundling and prospective payment systems include ICD-11 software and training, efficiency or quality improvement in support of these initiatives, S10 cost reporting and pricing transparency training. So this tends to be more focused on software and training. Next slide. And accountable care organizations, perhaps the least straightforward of the 3 categories. But this focuses on stuff like computerized provider order entry implementation and training, pharmacy services training, hardware and software, social detriments of health screening software and training, quality improvement training in support of ACO, system performance training in support of ACO, mobile health and telehealth hardware and software, which is, something I'd like to highlight. I know in our current environment, mobile health and telehealth have become much more common and prevalent. And so SHIP funds can be used to support that, although notably not specifically telecommunications. Community paramedicine hardware and software, and then health information technology training. Next slide. So here we're moving into the application and award process, and we're starting that off with some important dates. The application cycle opened on December 4th. Today's December 13th, and we're holding our technical assistance webinars for the application. The application cycle closes on January 15th. After that, we will review applications. We like to review the projects and offer feedback to applicant hospitals to help improve their project descriptions, or simply to guide them from unallowable projects to allowable projects. Those work plan and application edits and corrections are due by March 15th. June 1st is the program year start date. March 1st, we begin our year-end reporting cycle. That is not something we're going to cover in depth here today, but there will be a technical assistance webinar on the year-end reporting in the future as we get closer to that date. March 15th, 2025. Those are the technical assistance webinars I just mentioned for the year-end reporting. And then April 30th, 2025, the year-end report cycle closes. I do want to note that due to federal deadlines, failure to submit an application by January 15th by our application cycle deadline may result in loss of grant funds for the program year. This applies to existing participants who are submitting a new set of new work plan for the upcoming program year, and to new applicants trying to get into the program. We require your application be submitted by deadline. This carries over to the work plan edits and corrections. We need those back by deadline. And that is all simply because we need to submit all of this stuff to the feds on time to ensure inaccurate accounting of the number of participants and how much money everyone is getting. Next slide, please. So diving into the application process. Previously, if you've applied for SHIP through HCAI in the past, you've done so on the Qualtrics platform, which is a pretty straightforward platform where you just, answer the questions for the application. We haven't made it any more complicated, but we have moved it to HCAI's funding portal, which is the website where we run most of the applications for other programs that HCAI offers. We're just trying to bring it all to one platform. So to begin, all new and existing grantees and applicants will have to create a user account on the new platform. To do that, you will navigate to the HCAI funding portal and create an account. Next slide. Oh, I actually just covered this a moment ago. I think these slides might have been out of order. I apologize. But yeah, the HCAI funding portal does allow users to prepare, submit, and edit and review applications and year-end reports. And you'll also be able to track grant payments. And then we've included the URL for where the portal is located. Next slide. Here we go. Okay, back on track with the user profile. So after clicking create a profile, the first thing you'll see is this screen here, which allows you to select your user profile type. Your user type will determine what applications and grant programs you will see available to you. So it's important to select the correct one. We have an option for organization for small rural hospital improvement. That is the option you want to pick if you want to apply for SHIP. Next slide. You'll then complete your user profile. This information here is associated with the application, but it does not carry over in the form of any kind of contact information. So if the person filling out the application is the person creating this user profile, they will have to enter their contact information again on the application itself. Otherwise, the person submitting the application can be anyone at your organization. But they'll submit their contact information here, so we have their information in addition to any other contact information should we have any questions or concerns about the application. Next slide. And then beginning an application. So after you've created your user profile, you will be able to click apply here in the header of the HCAI funding portal website. And that will show you a list of open application cycles your user type is eligible for. If you selected the correct user type, organization for small rural hospital improvement, the only option you should see there is SHIP. And you will simply click that program name to open up a pop-up that briefly explains the program and allows you to begin your application. If you do see any other programs listed there, it will be because you chose the wrong user type on your user profile, but you can navigate back to your user profile to change that user type at any time. And if you have any issues with that, you can contact SHIP staff and we'll help you out. Next slide. So useful information, participation requirements. All hospitals seeking a SHIP grant must submit an application and a work plan each year. Okay, we want to mention that right now. Even if you, actually, I think I mentioned it a few minutes ago too, even if you are an existing grantee, you do need to submit a work plan each year. Even if you have a signed multi-year grant agreement in place, you need to submit a new application and work plan each year because you need to recertify your projects each year, or whether you've completed previous projects and are beginning new ones, or you're continuing ongoing projects. And then as you navigate the application, you'll do so using Save and Next buttons. We've got an image at the bottom of this slide here that shows what those look like to proceed to the next page of the application. And the Previous button is used to return to the previous page of the application as necessary. It's pretty straightforward. Additionally, the Save and Next button means that every time you navigate to the next page of an application, your progress is being saved. You do not have to fill out the entire application in one go. You can do a few pages, get up, walk away, come back later, and continue from where you left off. We'll cover how to do that in a moment. Next slide. Other useful information. So, oh, right, this is covering how to go back and edit an application you've already started. So if you want to continue an in-progress application, or even view a submitted application, you'll do so by logging into your user account. You will click on the Ship Applications in Progress or Submitted tab in the header, which is highlighted in the image there. And then there's a drop-down menu on the right-hand side of your screen, which you will click. That drop-down menu, if you have an in-progress application, will have an edit option, and you will click on that to continue editing your application, to modify your application. You'll also use that functionality if we kick the application back to you for edits after review. And then to review a submitted application, you'll use that same dropdown. There'll be an option that says View, and that will allow you to view the application as you submitted it. You cannot edit submitted applications. If edits are required, we will kick the application back to you. Effectively, it becomes in progress again. It'll be labeled as such, and you'll be able to edit it as such. But once an application has been submitted, no further edits are required. If you need to make changes to it before we've finished our review, you should contact Ship staff to let us know, and we will push the application back to you to the in progress status so you can edit it again. Next slide. So we don't have screenshots of the whole thing, but if you have applied in the past, I'll tell you now you're familiar with the application, the actual meat of the application. If you have not, this is intended to be a quick breakdown of the different sections of the application. It opens with a general information page, which is where you'll enter information we use to confirm your hospital's eligibility and to collect contact information for your hospital. We collect contact information, that is name, phone number, and email for 3 points of contact. Your CEO, your CFO, and a ship coordinator designated by your organization. One person can fill multiple roles if you choose. It could be 3 different people, however you want to do it. And again, none of those 3 people necessarily have to be the person submitting the application, although we do find the ship coordinator is usually the person submitting the application. The second page of the application is hospital information, where you will submit additional information about your hospital that is not necessarily related to the eligibility of your hospital for the program, but it is information the feds request, and so we have to collect it. After that, you get multiple pages on investment activities and summaries. This section is repeated for each of the 3 project categories we covered a few minutes ago. On each page, you will select from the list of allowable projects for that category. Selecting a project will bring up a text box that allows you to enter a summary for your intentions for that project. And that section is repeated again for each of the 3 project categories. If you are not going to undertake any projects in a given category, there is a none of the above option, and you'll be able to just skip that category. We also have work plan information sections for each of the 3 project categories, where you'll provide additional information about your proposed projects. And again, that section is repeated for each of the 3 project categories. Next slide. Next page after those 3 project categories will be budget, where we will ask you to provide an estimate of how much of the grant award will be spent on each of the 3 project categories. I mentioned earlier, we don't know the final award amount until we send these applications along to the feds. So on this page, you'll be working with an estimate. The estimate for this year is based on last year's award amount, which was $13,011. So you'll just work with that estimate and provide us an estimate of how much of the grant funds you will be using on each of the selected categories. The next page is network consortium expenditures. If you have any kind of networking or consortium activity, that page will allow you to report that information on your application. And the last page before you submit the application is a required document page. If you have indicated that you staff more than 49, that you have more than 49 beds at your hospital, you will also be asked to upload a written statement confirming that you only staff 49 or fewer of them. And the required document page is where you'll submit that written statement for our records. Next slide. And that would be it. You would submit the application from that point, and at that point, SHIP staff would review it. After application is submitted, we will review the application for hospital eligibility and project eligibility. As I mentioned, we often have some back and forth with applicant hospitals just to kind of fine tune the project descriptions. ensuring that the project description aligns with federal expectations and that the proposed projects are allowable. Simply selecting a project from an allowable category doesn't necessarily mean your project is fully allowable. We require the description to ensure that your intended use of funds meets all the requirements of the program. So if any edits are necessary, we will reach out to you to let you know. We will offer what guidance we can in terms of the necessary edits. And your application will be pushed back to the in progress status so that you can navigate back to the funding portal to your list of SHIP applications in progress submitted, use that dropdown, click edit, and edit the application to make the changes that we've suggested. Edits are due by March 15th, 2024. And again, due to federal deadlines, failure to submit those necessary edits by that deadline may result in loss of grant funds for that program year. Sorry. Participants who do not receive funds for a given year are not made ineligible for future years. So if you are already an existing grantee with the program and you just don't have any allowable projects for 1 year, or simply miss deadlines, unfortunately, you will be allowed to apply the next year, and potentially receive funds the next year. If you are a new applicant and you unfortunately do not have any allowable projects, you can still apply in the future in another program year and try to receive funds that year. And then stepping back, if after reviewing your application no edits are necessary, we will reach out to you to confirm that and make you aware of it, and we will pass your application along to the feds with everyone else's application. Next slide. So as I mentioned, HCAI passes completed eligible applications along to the feds in April of 2024. That is why those deadlines we've assigned are so important. If we don't get this information to the feds by April 2024, that throws everything off, and we may not receive any funding at all for any of our applicants or grantees in California. As I mentioned earlier, all eligible applicants with eligible projects are awarded if there is funding available, and the final award amounts are determined by FORB after receiving all applications. We will contact applicants and grantees with award information when it is available, and awards are paid out at the end of each program year after each participant submits their year-end report confirming completion of their selected projects. So we will go into more detail on the year-end reports in a future technical assistance webinar, but I do want to note here, as I've said in this webinar, the deadlines are very important, and we'll cover that again in the year-end report webinar. The deadlines for the year-end report are equally important. If you do not meet those deadlines, we may not be able to pay you your award afterwards. So next slide. And then the grant agreements. So SHIP grant agreements are multi-year. The current set of grant agreements ends on May 31st, 2028. So we do have some existing grantees already who are now submitting an application and work plan for the second program year of this 5-year grant cycle. But we're also opening up the program to new applicants who can submit their first application and work plan for consideration. Regardless of when your grant agreement is executed and signed within that 5-year cycle, the grant agreements will end on May 31st, 2028. As I noted, we will issue new grant agreements to new participants each year. Existing participants do not get a new grant agreement, but may get an amendment to reflect changes in funding. We did create the grant agreements for this 5-year grant cycle with the intent of being able to avoid any amendments, extra signatures, extra reviews. We shouldn't necessarily need them, but there is always a possibility. And we do use the DocuSign process to process grant agreements and amendments. All documents must be signed and executed through DocuSign. This is a requirement of HCAI. It's a fundamental part of our internal system on how we execute grant agreements. So a failure or inability to execute documents through DocuSign may result in loss of funding. If you have your own internal process for reviewing documents, we often have ways to work with you to ensure that we can still track everything through DocuSign, but that is not always the case. So I encourage you to use DocuSign as we send it to you, if at all possible. We will send the documents to your hospital CEO as designated on the application by default. But you can communicate with us if it should go to someone else for signature. There are rare cases where, for example, a CFO or even some fourth individual who is not, their contact information isn't collected on the application is required to sign. And we can work with you and make sure the documents go to the correct person. Next slide. Work plan changes and amendments. So if at any point during the program year, your hospital has to make changes to the submitted work plan for any reason, you need to contact HCAI immediately. This does happen. We get hospitals who they start out pursuing one project, things fall through in the middle of the program year, and they have to shift tactics, and that's fine, that's reasonable. But we do need to know immediately, because we want to be able to update your work plan immediately, confirm the new project is an allowable project immediately, really make sure all our ducks are in a row, so that we don't have a situation where a hospital switches tactics, moves to a new allowable project, and then goes to submit their year-end report for this new project, and it turns out this year-end, this new project simply isn't allowable, and that puts their grant funds at risk. You will be required to submit a year-end report at the end of the program year, which is what we'll use to confirm completion of your approved projects. But again, if you have to change projects, we prefer not finding out on the year-end report. We want to know ahead of that, so that we can make sure everything is aligned with the program's goals before we reach that point. If we reach the year-end report and find out your project is unallowable, that causes a scramble while we look for an allowable project that you may have done and not reported to us. And that's a process that can end up in missing deadlines and thus missing funding. And as noted, failure to complete approved projects or to alert HCAI to changes in approved projects may result in loss of funding. So it's very important that if you need to change your approved project, you notify us immediately. Next slide. And the last slide here includes useful links for more information and program contact. If you ever have any questions about SHIP, you can email us at ship@hcai.ca.gov. That's there on the right. The useful links on the left include a link to our website for HCAI, a link to HCAI's State Office of Rural Health website, which is actually part of the HCAI website. There is a link to the SHIP website page, which is where you can go to begin your application. And we also included a link to the Allowable Investment Search Tool, which is a tool offered by the feds. It is not an exhaustive list of allowable projects or allowable project metrics, but it is a very useful tool if you want to look up whether or not something is considered allowable within a given project category. We recommend referencing it if you're unsure. We reference it while we're reviewing applications. But if you find that the tool does not have any information on the project you're considering, contact us, because again, it's not an exhaustive list, and either we can offer you more information about a project's eligibility, or we can reach out to the feds, our federal contacts, and they can offer us more information. So next slide. And that's it. Thank you for coming. So I think we had intended to take questions in the chat, but since there are only a couple attendees here today, I think we're willing to open mics and take questions directly if everyone's open to that. So yeah, I'm cool with it.
All right, thank you, Nathan. As we work to get the mics unmuted, really appreciate all the work that you guys have put into this program. As we do transition into our question and answer session, go ahead and you can unmute or raise your hand, and then we'll know to call on you and unmute you, and we'll go from there. Let's see here. Have this ready to go in just a second.
Mics are enabled.
All right. Thank you, Alma. Appreciate it. All right. So if you have questions, go ahead and hit the raise your hand button at the top, and we will call on you and can ask questions away.
Maybe my webinar was more exhaustive than I realized.
You can also, if you don't want to come off mute, you can also enter questions in the chat, and that is another way that you can ask any questions you have. All right.
Good morning, gentlemen. A couple questions I will try to stump you with. I work with a district hospital association. I'm wondering if district hospitals in general are eligible, even if they're not a CAW, but they're a rural hospital.
Should be. I mean, we'd need to, you need to submit an application, or if you prefer, you can just email us and we'll, run through some questions, confirm eligibility. But I'm not aware of anything that would disallow a district hospital specifically, so long as they met the other.
Perfect. And then I know you mentioned that the average award amount was 13,000 for last year. Is that
that was the award amount for everyone? Yeah.
Okay. Is that pretty representative of what it usually is in the last few years, or do the amounts vary significantly year to year?
We have seen an increase. So I can only really talk to the last couple of years, but we have seen a steady increase in award funding year over year. Those increases haven't been massive. I think the lowest award amount I've seen on record is 10,000. But we don't expect a massive jump, between last year and this year. So if the award fund ends up not 13,000 per hospital this year, I don't think it would be a major change one direction or the other. So
great. Thank you very much.
All right. Thank you for those questions. And it looks like our other attendees have dropped. So Nathan, if Nathan Davis, if that was all the questions you have.
Well, I guess if I could ask one more, I didn't want to hog the whole time.
No, please.
So I want to make sure all the district hospitals that fit that criteria are applying. Is there a way to show or to get a list of who was awarded funds last year?
I would have to double check to make sure that's publicly available information. If it is, we could provide it to you directly. We don't necessarily have a list of awarded grantees available on the website. So I would recommend emailing that question to us so we can look into it. I'm just not sure off the top of my head if that is fully public information. So
perfect. Yeah, I would just like to get the information out there to any that either don't know about it, or, I mean, as you guys probably know, we've had a lot of turnover in the executive ranks of the rural hospitals, just given all the challenges lately. So just want to make sure the new people know about this program.
And we share that sentiment. Our main program administrator, Harold Fong, who couldn't make it today, is aware of that issue and is very invested in helping to communicate to all small rural hospitals the opportunity for this program. So, we don't always have contact information for every hospital, but we welcome any assistance in that regard. So
perfect. Yeah, we're happy to send it out to because we have 17 critical access hospitals, and then another 4 or 5 that are rural but not critical access.
Okay.
So
okay.
Happy to send the info to all of them.
Yeah, I would really encourage you to email us at the SHIP inbox, and we can work from there on that.
Yep, I will send you one in a moment with that question.
Awesome.
Thank you both.
Excellent. Thank you, Nathan. We appreciate both your participation and your help today on that.
Yeah, appreciate it. Thanks, guys. Have a good one.
Yeah, thanks, you too. All right, well, thank you for everybody's participation. And if you do have more questions, please email the team at ship@hci.ca.gov. As a reminder, we will be posting the webinar recording and the slide deck to our website. The webinar recording typically takes us 7 to 10 business days to get up on the website. We appreciate everybody joining us today. To learn more about the SHIP grant, we're excited to be able to offer it as a part of our health workforce development efforts at HCAI, and are grateful for your participation with us today. We encourage you to go to our website to discover all the great resources that HCAI offers. And as a reminder, the application cycle closes January 15th. And with that, we thank you so much for attending. We conclude today's webinar. Have a wonderful day.